After decades of strict regulation, rates of black lung disease are increasing in the mining industry. The disease is a lot to manage because it affects so many parts of the body and leads to multiple conditions. Some treatments are available, but as Clayton Baumgarth reports, getting access to care can often take years.
It's been nearly 40 years since Jeffrey Chandler left the coal mining industry.
It was a very dirty job. We would come home and we had to take our clothes off before we even went in the house, got in the shower. Our sinuses was just full of black coal. We'd breathe that daily, nightly.
He started working in mines in 1975 after serving in the military. A surface mining program at Ivy Tech set him up for immediate success.
We started out at $50,000 in 1976. Plus a truck allowance. The benefits was awesome. So that's what I did.
For a decade, Chandler worked as a drilling and blasting supervisor at various mines throughout Indiana, including Peabody Coal, Squaw Creek, and Rogers Energy in conjunction with the Black Beauty Coal Company. For a decade, he and his colleagues breathed in dangerous coal ash from surface mining operations.
I was a supervisor, and the safety never once told us you should wear a mask. You know, that it just wasn't thought of. You know, you just did your job and go, you know.
Now in his 70s, he suffers from black lung disease, an ailment affecting about 16% of those who work in the coal industry. He has an oxygen respirator, a lung spray inhaler administered twice a day, and 3 separate medications to manage his symptoms. The disease also affects his immune system.
I was in intensive care for 33 days. I didn't wake up for 33 days 2 years ago with pneumonia. I suffer from these all the time, constantly. So I just have to wear a mask, be careful where I'm breathing.
It's a lot to manage because according to one of the leading experts in the region, black lung isn't simply one single condition.
Black lung disease is what really the general public calls a spectrum of diseases that coal miners get from breathing in coal mine dust over the course of their careers.
Breathing in dust from mining can cause COPD, emphysema, chronic bronchitis, and more due to scarring of the lungs. And once a miner has coal ash in their lungs, there's no going back.
There really isn't much we as in the medical community can do aside from kind of supportive type treatments, inhalers like we would for COPD or people who need oxygen.
In 1969, Congress passed the Federal Coal Mine Health and Safety Act to better protect industry workers. But now, after decades of improvement, the number of miners living with black lung disease has started to increase. Though it's unclear why that is, some experts say that surface mining circulates coal dust more than underground operations. Others say the addition of other minerals in the dust can cause more scarring in the lungs.
It's as bad in some parts of the country as it was back in the early 1970s. And we think that's really because of silica that's in the rock that's cut next to the coal.
For those with black lung, the Department of Labor has programs that can disperse financial compensation from coal companies. But making the connection between miners in need and program administrators can be a challenge.
It's hardest to get the info out to people that weren't in a union mine because we don't know where to just randomly search for coal miners. So most of ours are union miners, but it's to anyone that was a coal miner.
Luckily for Chandler, a chance run-in with Rogers at a local restaurant led him to help.
I worked next door. I asked her what she did, and she told me she was with black lung benefits and told me a little bit about it. And I said, my gosh, can you help me?
Since 2021, she's assisted him in getting appropriate medical care and in navigating the stacks of paper needed to receive roughly $800 a month in financial aid. Chandler's case is typical. Some defunct coal companies have a trust fund to pay claims relatively easily, but others take years of lobbying to see results.
It depends on kind of how ruthless the coal company attorney is, because if they're constantly fighting everything and constantly sending them on exams, or we want a deposition or whatever it may be, that slows the process down.
For Chandler, he was lucky to stumble into the assistance that he got. Now, he wants other miners to know there is help out there for those in need by contacting the Department of Labor's Black Lung Program.
She's really helped me and a lot of people. But there's so many people out there that don't know that. They need to realize that, hey, you got a problem that there is help.
For Indiana News Desk, I'm Clayton Baumgarth.
In November of last year, the Black Lung Benefits Improvement Act was introduced in an effort to increase the monthly assistance given to sick miners. It has since been referred to the Senate Committee on Health, Education, Labor, and Pensions for further review.